Finding cancer early is optimal for providing the best treatment options, and it's largely dependent on screening tools and diagnostic procedures. When it comes to looking for prostate cancer, that often meant taking random samples. Now there's a newer option that's bringing this search into focus. Here's the latest in this week's Positively Healthy. Navigating for prostate cancer takes much more than luck. For years, an elevated PSA might trigger a needle biopsy, which sometimes missed the mark.
The way we would do biopsies was just a grid pattern, more or less. It was just sort of stabbing in the dark.
To get a better read, board-certified urologist Barclay Story often uses a different technique on some of his patients. It combines MRI visibility with an ultrasound to pinpoint areas of concern.
What it gives you is a much higher, much more accurate biopsy. And these guys who have been having 8, 9 biopsies over their lifetime because their PSA runs high can now go get an MRI and we can say, all right, we don't see any lesions, so we feel pretty good about this. Or I can say things like, you know, I see a lesion high at 12 o'clock, somewhere where we normally would never have done a biopsy.
Called a focal biopsy, it takes away a great deal of guesswork.
I've had a few patients come back who've had fairly aggressive diseases in areas where we might not have caught it before.
Targeting precise areas of concern is extremely telling in select cases.
It's very, very good in patients who have traditionally had PSAs done in the past. Their PSA continues to rise, and we are sort of caught between a rock and the hard place. We suspect there's cancer there, but we can't find it. This actually gives us an opportunity to try to go look for it.
Image-guided biopsies can also rule out cancer or may give doctors information to distinguish aggressive cancers from those which might not require treatment.
And if we don't find it, it gives everyone sort of a reassurance that there probably isn't cancer there, or we can watch this for a little longer.
Finding cancer, getting answers, focal biopsy is improving the standard of care.